it's Dr. Leah here, and this is a little video all about your thyroid. So as a naturopathic doctor, I often see women who are feeling pretty tired, burnt out, trouble focusing, concentrating, lots of brain fog, maybe having had gained weight or having trouble lose weight no matter what they do, never feeling rested no matter how much sleep they get, and just a general feeling of sluggishness and unwell. One of the most common questions I get is, do you think it's my thyroid? And there's a pretty good chance that it might be. So we as women are actually 50% likely to experience a thyroid condition or low thyroid function or hypothyroidism over the course of our lifetime. And if you've already been diagnosed with hypothyroidism, there's an 80% chance that the underlying reason for that is actually an autoimmune condition called Hashimoto's thyroiditis. So what I commonly see is in practice is that women will come in and say, I'm feeling all of the symptoms of low thyroid function that I mentioned before, including dry hair, skin, nails, constipation, headaches, feeling cold all the time, or really just struggling to manage your body temperature overall. And they say that their family doctor has tested their thyroid and always been told that it's normal. So what we do a really great job of in the conventional medical system is screening for disease. So the test that's most commonly run is something called TSH, which stands for thyroid stimulating hormone. And that's actually a hormone that our brain makes, just like a thermostat sends a signal to the furnace or our thyroid to turn on or off. And then our thyroid can respond by making something called T4, which is about 80% of the hormone that the thyroid produces, which then goes into our bloodstream to get converted to something called T3. This is the active form of thyroid hormone that actually gives us our energy and our metabolism and keeps our digestive system functioning and our concentration and cognitive function going. So a lot of times I'm seeing that only TSH has been tested, not the free thyroid hormones, which can easily be tested with the blood. And very rarely, even if TSH is abnormal, are antibodies being tested. And antibodies are what our immune system generates when it perceives a potential threat. So that's meant to be against things like viruses and bacteria, but for reasons we don't always understand, our immune system can start attacking our own tissues. And in the case of hypothyroidism, it starts attacking our thyroid gland. And so there's actually 2 antibody tests that you want to have done to discover if that's your underlying reason for low thyroid function. And that's called anti-thyroid peroxidase antibodies and anti-thyroglobulin antibodies. Besides all of those technical terms, what we're really trying to understand is how is your brain communicating with your thyroid, and how hard is your brain having to work to keep your thyroid on track. So in low thyroid function, you'll actually see that brain hormone TSH go up because your brain is working harder and harder and harder and having to send more and more and more of that signal to your thyroid to actually kick in and make those thyroid hormones. I also can't tell you how many times I've run a full and complete thyroid panel with a patient, so including TSH, free T3, free T4, as well as thyroid antibodies. The first 3 tests, which are conventionally tested on a regular basis, are always normal, not necessarily optimal, but the thyroid antibodies are elevated. That means your immune system is still reacting to your thyroid, and it's really only a matter of time until your thyroid function actually slows down. So what we do in that case is actually support your immune system to reduce those antibodies so your thyroid can go on in optimal functioning. If we haven't caught it soon enough to do that, we may actually have to prescribe you a thyroid hormone replacement. Sometimes patients also come in already on Synthroid or levothyroxine, which is the synthetic form of thyroid hormone, Synthroid, and that's only T4. So then we're relying on our body to convert that T4 to T3 for optimal results in thyroid functioning. That may be happening or it may be not, because you see your body can actually do something else when it's under stress or when it's nutrient deficient or when you have an autoimmune condition that's generating a lot of inflammation, and that's convert T3 to something called reverse T3. And that basically acts like a block to your thyroid receptors on your cells. So you might have normal amounts of T3 and T4 and TSH, but it actually can't get the signal to your cell. So I have some lab results of a patient in front of me because this is exactly what's happening. This is a patient who has been on thyroid medication for over 20 years, since the birth of her child. Her inflammation is high, her B12 is less than optimal, her blood sugar control is okay, her vitamin D is deficient, her antibodies are high, but her thyroid panel is quote unquote normal. She is already taking thyroid hormone replacement therapy, but what that is just the T4 like I mentioned. And we tested her reverse T3 and it's actually elevated above what it should be. Coffee. So what that tells me is her body is really just taking the synthroid and the T4 and converting too much of it into that reverse T3. So there's something called natural desiccated thyroid, which is actually dehydrated cow or pig thyroid gland. Sounds a bit gross, but it actually provides a full spectrum of thyroid hormones, so not just T4, but also T3, some of our other very trace minerals and other thyroid hormones. And that can be prescribed to you by a naturopathic doctor in Ontario and filled at a compounding pharmacy. The benefit of using that medication is that the T3 can help reduce that reverse T3 and can also then give you more energy and relieve those low thyroid symptoms that you might be experiencing. There was also this really cool study where they put a group of people who had low thyroid function, who were already taking thyroid medication, and they divided the group into two. They put one group on Synthroid, the other on desiccated thyroid, tracked their symptoms, tracked their lab work, didn't tell them which medication they were on, and then switched them and did the same thing. At the end of the study, both groups responded adequately and equivalently to the thyroid replacement hormone, regardless if it was Synthroid or regardless if it was desiccated. But when they were asked to rate their symptoms, even though they didn't know what medication form they were taking, the people who were taking the desiccated thyroid reported a higher quality of life and feeling better overall. We don't really know why, but it's a preference that patients often report. So if you are wondering if you have low thyroid function, if you have low thyroid function and you're wondering if it's autoimmune, or if you already know all of those things but haven't had some of these more comprehensive tests run, or are wondering if you would benefit more from desiccated thyroid than Synthroid, let me know. I'd love to chat with you and discover if there's something better that we can offer for your thyroid to ultimately get you feeling great.